In this age of internet, we have lot of knowledge, but we don't know really what is correct and what is not correct. So we'll just try to discuss few things about menopause. So what is menopause? Menopause is the final stoppage, final cessation of stopping of women's periods. So we say women has gone into menopause if the women did not have periods for at least 1 year. 1 year if she doesn't have menopause, then we say the woman has gone into menopause. Why should a woman have a menopause? It's a nature's protective mechanism. So nature is trying to protect women against what? Against reproductive morbidity and mortality. Means every pregnancy has its own problems, has its own punishments to the women. So the nature is trying to protect women against this pregnancy, reproduction capability of the women. Say if women did not have menopause, the women should have been producing children even at the age of 50, 60, 70. So the nature is trying to protect by giving menopause. But at the same time, once the menopause comes, it is as initial phases of aging. It marks the stage of aging, and it also makes the women at risk of many comorbidities, medical problems like diabetes, hypertension, heart problems, and all. So what happens when a woman goes into menopause? So before understanding that, let's understand about this hormone called as estrogen. So we know all women have a hormone called as estrogen and progesterone, and these are produced by the ovaries. So what does the estrogen do to us? Estrogen helps in many female reproductive functions like development of breast, development of pregnancy, development of uterus, periods. So the estrogen hormone is very important for a woman. Does this have any other non-reproductive functions? Yes. The estrogen is very important for many other organs in our body. What does it do? Let's look at this picture. So estrogen has main action on the brain. It controls the body temperature. It helps in memory function and libido adjustment. In the liver, it regulates the cholesterol production, makes our bones very strong. It has an anti-aging effect on the skin. It protects the heart from the cholesterol, and it also has all these reproductive functions on the breast, ovary and uterus. So estrogen is very important to us, not just for having babies, but for the other functions. So in menopause, the ovaries literally stop secreting estrogen. So a woman's body will not have estrogen, so the skin becomes wrinkled, bones lose their strength, brain confuses to how to regulate the temperature and starts forgetting things. So these are all the phases of symptoms of menopause. So now we know, right, why all the symptoms of menopause come. So main symptoms of menopause are we'll see in this picture again, lot of central nervous system symptoms. The brain gives a vasomotor symptoms, that means hot flushes, sleep disturbances, depression and anxiety, and cognitive changes. You get changes in your skin. The skin becomes very thin, loses its elasticity and becomes wrinkled. Lot of weight and metabolic changes happen. So lot of fat distribution happens. The fat from the shoulders and gets deposited under the waist. So the waist circumference increases. There is an increase of at least 3 to 4 kgs in a woman during the period of menopause. And there are lot of urogenital sexual function, decreased sexual desire and dyspareunia. Lot of urogenital symptoms like vaginal dryness, vulval itching and burning. There will be increased urinary frequency and increased urinary tract infections, and also changes in the musculoskeletal system, giving lot of joint pains and bone pains. So what about these symptoms? What is a myth about this? Myth about this is we get lot of women telling that they have vaginal dryness, lack of sexual desire at the age of 40 or 50. So when the women has just stopped their periods, they are just now off their estrogen. So this vaginal dryness and loss of sexual desire doesn't come so soon immediately after menopause. So after menopause, every woman will have bit of stages, so which is early postmenopause, late postmenopause. In the early postmenopause is immediately after menopause, say 5 to 8 years after menopause, where the women will have lot of hot flushes, lot of somatic changes like body pains. That's all. So vaginal dryness, the genitourinary symptoms and osteoporosis comes bit late. Osteoporosis is weak bones. They come bit late after 10 years. So prolonged estrogen deficient, prolonged period of lack of estrogen definitely gives weak bones, but that's after 10 years. And even very late, maybe at the age of 70, the brain's symptoms come like lack of memory, loss of memory, all these things come. So if a woman at an early age says vaginal dryness, it's not because of menopause. It's maybe because of some other infections, some other reasons. So you should consult your doctor, not just leave that it is menopause. Similarly, if a woman very early has fractures in her bones, has weak bones, then it's not because of menopause. Immediately after menopause, the bones doesn't break. So if it is breaking, then you should consult your doctor. Maybe it is some other reason that the bones have become so weak immediately. It will take at least 5 to 6 years for all these changes to come and the weak bones to manifest. So after knowing about these symptoms, what should we do? Should we just live with them and suffer with them, or can we do anything about this? So doing anything doesn't mean just taking medicines. Yes, there are definitely medicines for everything. For each of the symptoms which we have discussed, there are a lot of medicines. But we can do some non-pharmacological things, like for example for hot flushes, we can eat some foods like flax seeds, some banana flowers, banana stems, which definitely helps for the hot flushes, and some yoga poses like these yoga poses definitely do help a lot for the hot flushes. You should be taking a lot of B12 supplements, multivitamins, which keeps you hydrated and help you from the hot flushes. And for the genitourinary symptoms, recurrent urinary infections. So you should take care of your genital hygiene, especially the urinary thing. Take care of your water intake. But if you do catch an infection, it should be treated with antibiotics. And the osteoporosis, the weak bones. So the changes actually start at menopause. So within 1 year of attaining menopause, most of the bone strength is lost, but it shows a bit late, at least 10 years later. So for this, to protect against the bone loss, can we do anything? We can definitely do a lot of weight strengthening exercises. So it's not just walking or not just strolling in a park, which helps at menopause. So if you have not exercised throughout your life, that's okay. But when a woman is going through menopause, she has to exercise to keep her bones healthy. So what type of exercises? It's definitely weight bearing or weight strengthening exercises. So all of the women who are at the 50 get 2 kgs, 3 kgs weights and do the weight strengthening exercises at home. So menopause is not just end of the life. It is a beginning of a new phase. So live happily with menopause, and you have to get screened with lot of, so there is also an increased risk of cardiovascular, myocardial, heart attacks, risk of paralysis. So you have to get your annual screening done for your lipid profile, for your cholesterol, screen for your heart problems, screen for your brain problems every year. Annual screening should be done after 40. And what about the cancer risk? So there are a lot of women who are worried of cancers once they come into menopause. So it's usually the breast cancer and the uterine and cervical cancer which we talk about in women. So can we do anything for that? Yes, definitely. We have to get a test called as pap smear. Pap smear is a test from the cervix. Cervix is the lower part of the uterus. At least once in 3 years till the woman is 65, we have to do the pap smear, and we can get an ultrasound for the uterus. So the uterus and ovaries are seen on an ultrasound, and similarly we can do a mammogram for the breast. So when you're getting a health check to check your cholesterol and other organs, similarly get these tests to check for any early changes or precancerous changes of the breast, uterus and cervix. So enjoy your menopause and stay healthy. Thank you.